Diabetes mellitus, commonly known as diabetes, is the seventh leading cause of death worldwide. This video will talk about its types, symptoms, risk factors, and complications. Be sure to watch till the end. You will learn the exact criteria for the diagnosis. Diabetes is a metabolism disorder related to insulin. It is high blood sugar levels over a prolonged time. Insulin controls blood sugar levels. It helps store sugar in our liver, fat, and muscles. Finally, it regulates our body's metabolism of carbohydrates, fats, and proteins. The malfunction of this hormone will wreak havoc in our bodies. As of 2019, an estimated 463 million people had diabetes worldwide. In the year of 2019, diabetes resulted in approximately 4.2 million deaths. There are three main types of diabetes mellitus. Type 1 diabetes. In this type of diabetes, the pancreas fails to produce enough insulin. It is also called insulin-dependent diabetes mellitus or juvenile diabetes. It is responsible for approximately 10% of diabetes cases. Type 2 diabetes. Initially, the body produces enough insulin, but cells fail to respond to insulin appropriately. At a later stage, the quantity of insulin may also decrease. It is also called non-insulin-dependent diabetes mellitus or adult-onset diabetes. Type 2 diabetes is the most common type of diabetes mellitus. Gestational diabetes. It is the condition of high blood sugar levels that occurs during pregnancy. Gestational diabetes usually resolves after the birth of the baby. However, untreated gestational diabetes can affect the health of the fetus or mother. What is prediabetes? People with prediabetes have higher than normal blood sugar levels. But they are not high enough to be diagnosed with type 2 diabetes. Although this condition seems mild, unfortunately, it may cause damage to our heart, blood vessels, and kidneys. So it is wise to seek medical advice right away. What are the signs and symptoms of diabetes? The classic symptoms of untreated diabetes are increased urination, increased thirst, increased hunger, unintended weight loss. People with type 1 diabetes may develop symptoms in weeks or months. In contrast, people with type 2 develop symptoms much more slowly. And sometimes, they may not even have any symptoms. Other symptoms could include blurred vision or vision loss, headache, fatigue, slow healing of wounds. What are diabetic emergencies? People with diabetes may develop emergency conditions that could be dangerous. 1. Diabetic ketoacidosis, DKA. It is a severe complication that can be life-threatening. Because of a low insulin level, the cells cannot use sugar as energy. So your liver has to break down fat for fuel, a process that produces blood acids called ketones. When ketones are produced in large amounts quickly, they can build up to dangerous levels. Typical symptoms and signs are shortness of breath, excessive thirst, fruity-smelling breath, weakness or fatigue, nausea and vomiting, confusion, blood sugar level consistently higher than 300 mg per deciliter, or 16.7 millimoles per liter. Contact your doctor or seek emergency care if you have the above signs or symptoms. 2. Hyperosmolar hyperglycemic state, HHS. It is life-threatening dehydration caused by high blood sugar levels for an extended period. It is more common in type 2 diabetes. Typical symptoms are extreme thirst, frequent urination, changes in your vision, confusion or a change in your mental state, coma. Contact your doctor or seek emergency care if you have the above signs or symptoms. 3. Hypoglycemia. It is low blood sugar caused by diabetes treatment, for example, insulin or other medications. Mostly the symptoms are mild, but in extreme cases, it could cause death. Feelings of unease, sweating, trembling, confusion, changes in behavior such as aggressiveness, seizures, unconsciousness, permanent brain damage or death in severe cases. A fasting blood sugar equal to or lower than 70 mg per deciliter or 3.9 millimoles per liter. Treatment involves quickly getting your blood sugar back to normal with high sugar foods or drinks. Contact your doctor or seek emergency care if your symptoms do not improve. Long-term complications can develop after 10 to 20 years of diabetes. They may be the first symptom for people who do not know they have diabetes. Diabetic retinopathy. It is the damage to the blood vessels in the eye's retina. Typical symptoms are gradual vision loss, blindness, glaucoma, cataracts and other eye problems. People with diabetes should visit an eye doctor once a year. Diabetic nephropathy. It is the damage to the kidneys, which can lead to urine protein loss and chronic kidney disease. In severe cases, the patient may need dialysis or kidney transplantation. Diabetic neuropathy. It is the damage to the nerves of the body. This most common complication of diabetes can have the following symptoms: numbness, tingling, abnormal sweating, pain or altered pain sensation, skin damage, diabetes-related foot problems. Recurrent foot ulcers are difficult to heal, leading to foot amputation. Finally, diabetes can also increase the risk of cardiovascular disease, stroke, and dementia. Risk factors for type 1 diabetes. While we cannot identify the exact cause of type 1 diabetes, we do know the following factors are high risk. Family history. People who have a parent or sibling with type 1 diabetes may have a higher risk. If both parents have the condition, a child can have 1 in 4 of the chance of getting it. Environmental factors. Factors including diet, vitamin D intake, infections, and gut microbiota could play a role in developing type 1 diabetes. Autoantibodies. Autoantibodies in your blood indicate a higher risk. Geography. Finland and Sweden have higher rates of type 1 diabetes. Risk factors for prediabetes and type 2 diabetes. Factors that increase the risk include weight. Fatty tissue is more resistant to insulin, and more fatty cells use less blood sugar. So overweight leads to higher blood sugar levels. Inactivity. Physical activity helps with weight loss, burns sugar, and makes your cells more sensitive to insulin. Inactivity negates all these benefits. Family history. A parent or sibling with type 2 diabetes generally increases the risk. Race or ethnicity. Black, Hispanic, American Indian, and Asian American people are at higher risk. Gestational diabetes. A history of gestational diabetes increases the risk. Polycystic ovary syndrome. This syndrome increases a woman's risk of diabetes. High blood pressure. Blood pressure over 140/90 mm Hg is also a risk factor. High-density lipoprotein. Low levels of HDL increase the risk. Triglycerides. High levels increase the risk. Diagnosis. Diabetes mellitus is diagnosed with a test for the sugar content in the blood. The specific criteria are as follow. 1. Glycated hemoglobin, A1C, test. This blood test measures the percentage of blood sugar attached to hemoglobin. A level of 6.5% or higher on 2 separate tests indicates diabetes. A level between 5.7 and 6.4% indicates prediabetes. A level below 5.7 is considered normal. 2. Random blood sugar test. This test can be done at a random time. A blood sugar level equal to or higher than 200 mg per deciliter or 11.1 millimoles per liter indicates diabetes. 3. Fasting blood sugar test. A blood sample will be taken after an overnight fast. Normal is blood sugar level less than 100 mg per deciliter, or 5.6 millimoles per liter. Prediabetes is a blood sugar level from 100 to 125 mg per deciliter or 5.6 to 6.9 millimoles per liter. Diabetes is equal to or higher than 126 mg per deciliter or 7 millimoles per liter on 2 separate tests. 4. Oral glucose tolerance test. For this test, your fasting blood sugar level is measured in the morning. You'll then drink a mixture of sugary water. You'll get another blood glucose test 2 hours later. Normal is less than 140 mg per deciliter or 7.8 millimoles per liter. Prediabetes is between 140 and 199 mg per deciliter or 7.8 and 11.0 millimoles per liter. Diabetes is more than 200 mg per deciliter or 11.1 millimoles per liter. A quick reminder, this video is for information only. Please seek medical advice from appropriate healthcare professionals. If you like the video, give it a thumbs up and share it with your friends. Comment below to share your thoughts about diabetes. Please subscribe to our channel. Your support means everything to us.